Sylvia and me.
Sylvia and
Sylvia and me. Sylvia and
Sylvia and me.
But I rate friendship as highly as I rate our romantic relationship. And in that way, people find me very abnormal. Joan, when I'm invited to an event, a bar mitzvah or a dinner, and they say, bring your plus one, I'll show up with one of my girlfriends, my close girlfriends.
The most important people in your life are not necessarily only a romantic partner.
Hi, I'm Sylvia Beckerman, host of the podcast series Sylvia and Me. Conversations with inspiring, empowering women.
Hi, my name is Joan DelFattore. I'm a retired professor from the University of Delaware. For the last several years, I have been writing about issues that single people face in American healthcare. I myself have been single my whole life. I'm 77.
Hi, I'm Jaclyn Geller. I teach restoration and 18th century literature at Central Connecticut State University. My most recent book, and I write about non-marital issues and non-marital life and non-marital family. My most recent book is Moving Past Marriage, Why We Should Ditch Marital Privilege and Relationship Status Discrimination and Embrace Non-Marital History. And I'm delighted to be doing my second podcast with Sylvia Beckerman.
Joan.
Welcome to Sylvia and Me.
Thank you. Joan, Jackie, I want to welcome you back to the podcast. Both of you were here separately several months ago. You know, time flies when you're having a great time. And I thought it would be great to have both of you here together, because I think there's so much that we can cover. Joan, your focus is on single, on individual, and having support from not a nuclear family per se, but friends and other associates you have, and you're single, as you said, by choice. Fantastic. Jackie, your focus is on the stigma, the inequality of marrieds to unmarrieds and the benefits that marrieds get, over 1,000 benefits. You know, one of them, the Social Security benefit and so on. So we're going to go into that. Right now, what I'd really like to do is talk about being single and what exactly that means, because there are so many things going around. There are surveys done, studies done, and the headlines are always marrieds are happier than singles. Joan, can you give us your take on that?
Sure. Bella DiPaolo, who is a pioneer of single studies, she's a Harvard-trained psychologist. She makes a distinction she calls single at heart. That is, people who are single because they want to be single, rather than people who are single because that is where circumstances have led them. In some cases, people who are single may choose to be single because it's better than any of the actual options they have, but that may not necessarily have been plan A. So I think we need to distinguish three levels. Those like me, for whom being single is plan A, because the privacy, independence, and autonomy of a single life, I would not trade for anything. So you have that single group, which DiPaolo calls single at heart. Then you have people who are voluntarily single in the sense that they prefer to any other option at this time. Quite a few older widowed women are in that category. Given what their choices are at this point in their life, they would prefer to remain single as opposed to any other choice. Then the third category among singles would be those who are determined to find a partner, those who will not be happy without a partner. I would tend to distinguish also people who do not have a committed romantic relationship from those who do, because I think in the view of the couple-centric society in which we live, someone like Jackie who has a romantic partner is seen as somehow, quote, more normal than someone who does not have a life partner at all. So there's that distinction as well.
Jackie?
Yeah, for the very reasons that Joan delineates. I have never used the word single or coupled. Um, I find that they don't even come close to the richness of the relationships that I have, most of which predate my relationship with my wonderful boyfriend. But I have friendships that go back many years. A close one with my college professor, who's an older gay man, who's been my intellectual mentor. If it weren't for him, I would not be in the field that I was in. I wouldn't know how to do research, how to write. My best friend, who I call my sister, legal guardian of her 3 children, very close with them. They call me mom number 2. And I've just been very blessed to have all these partners. So when I have to fill out a form, I don't write single or married. I say significant loving relationships, and I list about 9 people. Or sometimes I just say interdependent, which is a legal term used in Canada, for having a clustered a family that one has chosen, a chosen family. Single to me, and Bella DiPaolo, who's my colleague and friend and intellectual beacon, it uses single proudly, and I respect that. And everyone has to find their own terms, but single for me is incongruous because it diminishes those wonderful relationships that I had before I met Jim. He is one of the many relationships I have in my life, but I rate friendship as highly as I rate our romantic relationship. And in that way, people find me very abnormal. Joan, when I'm invited to an event, a bar mitzvah or a dinner, and they say, bring your +1, I'll show up with one of my girlfriends, my close girlfriends, or a close male friend. And, oh, who's this, where's Jim? You said +1. You didn't specify that it had to be the person I'm having intercourse with. Is that what makes a relationship? Because if it does, most married people I know are not married, to be very honest. So I think our whole terminology has to change, and I see it starting to even change on medical forms. It will say, family status, or describe relationship, or sometimes just, are you covered by another insurance plan? It won't ask these intrusive questions. But our language hasn't caught up with our lives. I think friendship in many ways is the real cherished relationship in the 21st century, at least if you look at the television programs and what millennials are into.
The other thing is society hasn't caught up on, yes,
That's
I know
right.
there's a huge history on marriage and why it started thousands of years ago. But I think for these purposes, we can just go back to the 50s when women and men both had a role. I don't want to just talk about the women, because the men were at a very young age supposed to meet someone. The woman was supposed to maybe go to school, be a secretary, find a guy, get married, move to the suburbs, raise a family, and take care of the family, cook, clean, and so on. And the male was supposed to then support and take care and protect the family. And look what we were asking from very young people back in the 50s, during a time of, we came off of World War II, there was the Korean War. I mean, such upheaval that everything was supposed to be nice, nice, nice. And we're in a time where women are working, families, whether you're coupled or not, both parties are working. So the need that there was to get married before is not a need, and people are realizing that the most important person they need to love is themselves, and then figure out what they want to do next, because marriage is not necessarily the next step, and it doesn't have to be in a person's life at all, which unfortunately, there's still so much stigma to being single, being single, being not married, but a couple. And it just goes on and on and on. One of the areas that that I really want to get into, because it's such an important segment of the stigma of being single, of being uncoupled, and that is the healthcare system, the American healthcare system. I want to go to you, Jackie, first, only because I want to go back to you have a long-term boyfriend, and prior to 2008, someone you were living with, a domestic partner, I believe it was called, you were able to get onto your insurance policy.
Yes. I think in the 1970s, going through the 80s, the 90s, there was a movement that permeated the feminist movement and the gay rights movement, who worked together to make marriage less important rather than more important. That was a shared goal. And one of the outcomes was that companies like Ben and Jerry's, like the Village Voice, a newspaper in New York City, like my alma mater, Oberlin College, began to give partnership benefits. They were sometimes called civil partnerships. They were sometimes called domestic partnerships. There was different language, but the idea was that with a romantic partner that one had been living with for a very long time, or that one had a purported commitment to permanence with, one should not have to marry that person to be able to get a mammogram, or to be able to get a kidney dialysis treatment. That one should not have to. You should have the option of getting married, but it shouldn't be a prerequisite for having like a roof over your head. So Oberlin even included within the health plan subsidized housing for people that were in couples. Now, there were a lot of problems with this. It still was based on what Joan has identified as romantic exceptionalism, so that it was, one couldn't apply it to a long-term roommate who was your best friend, or your cousin that you had lived with since childhood, or your two best friends who you were farming with. Like here in Connecticut, it's the same thing. Farmers can only get state aid if they're married, which makes no sense because most farming cooperatives are not marriage based. But the thing is, this was seen as progress. This was hailed as progress because it was acknowledging the fact that sex outside marriage was not bad, and that not everybody was going to be monogamous who had a marriage partner, who had a lover. Not everybody wanted to be joined at the hip, as you talked about in the 1950s model. And I think even more significantly, in the 1950s, there was a whole psychological literature that discouraged friendship, particularly female friendship, on the grounds that it was considered neurotic and suspicious, and that there were sexual undertones to it, and that it was also diverting women's energies away from the children. Okay, so this was progress away from that idea. After Obergefell versus Hodges legalized gay marriage, many companies, and I'll mention a few, Verizon is one, an enormous company, other companies that I am now blanking out on, but they're in my book, began yanking these domestic partnership rights, so that the argument was everyone can get married. Now, they didn't see that this argument also meant now everyone has to get married who wants help, who wants their family covered. So it was a very, I think it was very retrograde, and what we should have had was what the French have, which is Pax, which is if someone's in a significant relationship of any sort, sexual or not, that's long-term, life structuring and committed, you can put them on your health insurance. It doesn't have to be a lover, but it can be. So kind of everybody's covered. So when my boyfriend became ill, and he had always been gainfully employed, but he was too sick to work for a period. He had very bad chronic fatigue stemming from a rather rare virus. I called the HR company of my school, and I said I need to put him on my health insurance. Central Connecticut State University had always had civil partnerships. Many of my colleagues are not married and have different dating arrangements, or people that they live with. And the woman just said, "Oh no, we've changed all that. You have to be married." And I said, "Well, we can't get married." And she said, "No, you can. Everyone can now." And I said, "No, everyone can't. There are those of us that are not going to stand in front of God and everyone and say that we'll be together for the rest of our lives if we don't know. There are some of us who cannot attach ourselves to the oppressive history of marriage, which is totally sexist. There are some of us, not saying it's me, who are not monogamous or consensually non-monogamous. There are others for whom friendship equals marriage. That would be me, or equals romantic relationships, that aren't going to single out one person and elevate them above the rest. I can name you 10 more reasons why I can't get married, but the most obvious reason is I write about marriage satire in the 18th century, and that's why the English department here was interested in me. They thought that was an unmindful. So of course you have to put him on, and there was no wiggle room.
I mean, the bottom line is you have no desire to get married. You're happy.
I have no desire to get married, but desire is such a tricky thing.
Okay,
I mean,
you're not getting married.
Yeah, no.
And you could
it was telling me I had to get married,
right,
or he could not see a doctor. And that is bad. It's unethical. Yes. It's ethically very dubious.
Okay. And so we have that part of the healthcare system, the American medical system, where just because you're not getting married, but you've been living with someone for quite some time, doesn't matter for how long, they're no longer allowed on your insurance plan because a law got passed saying that if you're going to live together and you want to have some of the 1,000 benefits from getting married and having a certificate, they can't go on your insurance. So I want to turn to you, Joan, because you have insurance, you have a whole group of friends, you do not have a domestic partner, or whatever we want to name that other person, your boyfriend, friend. You're not living with anyone. Can you please just describe, because it's the most bizarre, what happened to you? Because I know that your TED Talk back in 2017, it was called "Sick While Single, Don't Die of Discrimination."
Joan's story is amazing.
Essentially what happened, as you said, Sylvia, even though I am single, I do not fit the stereotype of a lonely, isolated introvert. I'm not an introvert. I'm not lonely. I'm not isolated. The fact that I have not chosen to have a particular kind of social relationship does not mean I don't have social relationships. I totally agree with what Jackie said, and I love the way you said it. Other relationships are as important as romantic relationships. There are people who will drop everything and come if I'm in an emergency room or something, and I would drop everything for them. It doesn't have to be a romantic relationship. It doesn't have to be particular family relationships. It doesn't have to be a sister or a father or a brother. It can be whoever fills that role in your life. Well, I was diagnosed in 2011 with a very rare and very deadly form of cancer it was stage 4 gallbladder cancer. I was fortunate to find a surgeon. His name is Ronald DiMatteo. He was at the time at Sloan Kettering. He is now the chair of the Department of Surgery at Penn Medicine. Unlike any other surgeon I had seen, he was now the 9th doctor I had seen. He was willing to take a chance on doing the surgery. Everyone else said it was not operable. And it's only because of that I'm still alive. After the surgery, I had to have chemotherapy because with stage 4, as you know, what that diagnosis means is that cancer cells are microscopic cancer cells are circulating in the bloodstream. So the medical oncologist at Sloan Kettering suggested, why don't you try to get treated closer to home? So I went to an oncologist at a major medical center closer to home, and he got really hung up on my family situation. We went through this litany. You have no husband? No. You have no sons? You have no daughters? You have no sisters? You have no brothers? I'm not exaggerating. That's what he said. And at the end of it, he said, then how will you manage? So I started to tell him about the friends and cousins who had been with me through the surgery, who had helped me with that. So it wasn't hypothetical. I knew I had the help. I couldn't even finish the sentence. He interrupted before I even finished the sentence, waved away friends and cousins, and proposed to give me one mild drug. Well, fortunately, I already knew that the standard of care chemotherapy for what I had was that mild drug in combination with a much stronger one. So when I asked him about the stronger one, because we had already established I had no health issues that would have gotten in the way of aggressive chemotherapy, he was not happy to be challenged. And his response was, oh no, I wouldn't risk those side effects with someone in your situation. So I went back to Sloan Kettering to Dr. Eileen O'Reilly, who had no problem giving me the right treatment. She had no problem with the fact that it was cousins and friends and not other designations. But I was curious about it. I've been a researcher all my life. So when I was feeling better, I thought, was that just that one guy? Because I could not get away from the thought, what would happen to a single person who didn't know that that wasn't what they were supposed to be getting? Because the way he said it was as if he would have given that same treatment to anyone. He didn't say, until I challenged him, that he was leaving off a very important part of the treatment. I had the correct treatment. I did the research and found out that what he had done was standard practice, that what he did was acceptable. There is a body of medical literature, goes back to the mid-1980s, based on a database that the National Cancer Institute maintains. It's the short form is SEER. It's a database that now has records of 10 million patients who were treated for cancer in the United States starting in 1973. That database can be searched, cross-referenced between marital status, the treatment you received, whether you survived. If you did not survive, did you die of your cancer or of something else? You can cross-reference with age, insurance status, all kinds of things. I found a body of medical literature. At this point, it's well over 100 articles going back to the mid-80s, which consistently say, based on that database, I'll give you the number from the definitive article. This is a study that was done in 2013 by physicians at Harvard, MD Anderson, top institutions. They looked at 750,000 patients. So this is a definitive study. Their finding was that a person who is currently married is 53% more likely to get appropriate cancer treatment than the same patient would be if you were not married. And their conclusion, like everybody else's conclusion, is that that is inherent in the superiority of the married state, and that it's just natural that unmarried people can handle aggressive treatment and don't want it. So at that point, I wrote an article and submitted it to the New England Journal of Medicine, which accepted it. And that was only the second time. There was an oncologist in Sweden had brought this up once before in the British Medical Journal, but that was the first time in an American medical journal that anyone ever questioned that insistence, totally based on on the physicians' social views, totally contradicting everything we know from psychological and sociological research. They simply assumed if you're not married, you don't have social support.
So ladies, let's just have a discussion about the stigma of being single, the stigma of not being married, which one of the things is in your health, it could prevent you from getting the health care that you need because you haven't checked off the box that says married. You're supposed to not be as happy as your married friends, as people who are married, and the data that comes out, the research is so one-sided, bias. That's the word. I was going to use that word. I wasn't sure I should, but I thank
No,
you
it's
for that.
heavily biased.
So let's open up the discussion. I'd like to hear you gals do the research. What have you found?
Well, I just want to, following up with Joan, to say, I think that it's incredible, your story, and that you're here with us today is such a blessing. I want to ask listeners to imagine a patient going to that same doctor who's an oncologist, I imagine, the one who
Yes.
didn't really want to treat you because, you may as well it's going to fail anyway because you have no support, because you have no life, because you have no husband, which is his assumption. I want to imagine, instead of a brilliant professor with a PhD, articulate, confident, and self-aware like Joan, a person without a high school degree goes in without a husband, is happy, has friends, is happy, doesn't and doesn't know about research and data and the things that we learn in graduate school, and doesn't challenge the doctor who presents himself as completely authoritative and stating truths that are self-evident. That person could die. I mean, this is serious business. I wanted to tie it to some of my own historical research that I found, which is it's not just that people with serious conditions are treated differently when their marriage status, their relationship status is different. It's that unmarried people, including those like myself who have a boyfriend or girlfriend or whatever it is that they call them, are also lots of illnesses are attributed to us that we actually don't have. We're told that we have higher rates of depression, and we're told this again and again and again by major periodicals like Time Magazine, where one of the great phonies, intellectual phonies of our time, she has a dazzling degree in education, but pretends to be an amazing scholar of science, Belinda Luscombe, has written that people who aren't married are more likely to become handicapped. This is sheer nonsense of the most frightening sort. And she also counterbalances this with warm tales about her marriage and her handsome, strong husband, as she calls him. But in the Renaissance, there was a disease that suddenly emerged, and it was afflicting women who were virgins, and it was afflicting women who had no husbands or prospects, and it was called green sickness. And epidemiologists have done histories of this. It had absolutely no symptomology. The symptoms were all over the place. This was diagnosed for unmarried women until the 1930s, when in this country it was called chlorosis. There is no disease. It doesn't exist. It's a fantasy. But what the origins of the word, the etymology, are kind of interesting. Green sickness, what does that mean? Well, green by the Renaissance meant envious. So it meant women who were envious of other women who had husbands, and the envy made them
Sick.
Have dizzy spells or nausea or see flashing lights, or I mean, in each textbook it was different. Lose their appetites, faint. The bottom line is that it wasn't until the 20th century that this was invalidated and taken out of medical textbooks. So it's very strange. I don't know if any studies have been done, but I would not be surprised if people who went to psychiatrists and said, I'm dealing with this situation, as soon as you check the non-marriage box off, if they're more likely to say, well, you're depressed, or, to give antidepressants. I don't know. That's just a guess, but there's an enormous amount of bias built into the medical system. I'd like to also add that the National Institutes of Health, largely considered the best hospital in the world, that run paradigm shifting, pathfinding studies on all diseases and is one of the concentrations of the greatest medical minds in the world. I found when a friend needed to go there for surgery that they cover they cover everything. It's free. You don't need insurance. You join a group, a study, and they monitor you and they give you whatever treatment you need. But I found that a friend of mine, when he was going in for brain surgery, his wife would be covered. Her travel and airfare would be covered, but mine wouldn't. I had to pay for my own. I had known him quite a bit longer than his wife. But I will tell you, I don't even think this is fair to married people. A married person might not want their spouse traveling with them. They might want, let's say, their brother who's a physician, their best friend who's a nurse, their cousin who they've known since childhood, and that person is going to be less riled up than the spouse. It does a hard science environment with the best doctors in the world still foists romantic partners on each other to get each other through surgery. And I think that that's outrageous. So Joan has experienced a blatant, shocking, life-threatening form of discrimination, but there are many others within the medical system.
Joan, I throw it over to you.
I'm just scribbling a quick note because I'm glad to know what Jackie was just saying. I want to make sure I don't forget. Yeah, another way that discrimination happens besides the treatment of individual patients is in the policies. And that's essentially what Jackie was just getting at. And that's an excellent example of it. Sometimes, though, it's not only the written policies, it's also the behavior of the staff who don't respect the right of a non-spouse or a non-family member, even when that right exists.
I want to interrupt you because I think that is even more important. Because the written you can sometimes get around by writing some, but the attitude and the perception of the staff. Go ahead, Joan.
Let me give an example of each one just very quickly. An example of a policy that's a problem is the Family Medical Leave Act, FMLA. The federal FMLA says that an employee in a business to which that law applies, basically businesses with more than 50 employees and also public employment, like a public school teacher. If you're in a job to which the FMLA applies, if you're under the federal, some states have their own, if you're under a federal, you can take unpaid time off from work, exactly what Jackie was talking about before, for a spouse, and it has to be married, for a spouse, a child, and that's it. So if you don't have a spouse or a child, I think a parent is in there as well, you have no right to take time off to care for someone else. Well, stop and think about the way our healthcare system works. We have a healthcare model in which patients are required to have their own personal care system because the medical institutions throw you out the door the minute they finish giving you the pill or doing the surgery. They don't provide any kind of aftercare. They don't provide rides. They don't provide anything. You have to have all that for yourself. But then the federal law says nobody can take time off to care for anybody else except in those very narrow relationships. As Jackie was saying before, some of these things are unfair to married people as well as unmarried. What if you have a couple where the spouse is disabled for whatever reason and they don't have children? Nobody else, their grandchild can't take time off, their nephew, their niece, their neighbor, nobody else can take time off to take care of them, even though they would be willing to. So we have the unreasonable bind of a healthcare model that says you have to have a dedicated personal caregiving system, but it has to be these particular people. And if you don't have them, or if they're not able to do it, well, I guess you're just out of luck. So that's an example of a policy that I would respectfully suggest needs to be changed. The example of healthcare providers, the HIPAA, the Health Insurance Portability and something or other
Privacy Act.
Thank you. That one there. HIPAA explicitly states that a competent adult patient can choose their own caregiver and can choose who gets the information. So when I went into Sloan Kettering for the surgery that I had, they gave me the form to fill out while I was actually on the gurney in the cubby in the cubicle before I was taken in for surgery. So they gave me this form to fill out. It was a HIPAA form, and it said, who should we give information to? Well, I had 2 cousins and a good friend with me. They were in the hospital. So I put their names, and it asked for the relationship, which it really shouldn't. Why do you
Right.
want to know what the relationship is? It's none of your business. I'm entitled to say who I want. But I put cousin, friend. So the nurse took it. She said, no, it has to be immediate family.
Excuse
Well,
me.
it doesn't. No, I didn't
Oh.
know at the time that it didn't. I looked this up later when I found out what had happened. All right, so I had the surgery. A day or 2 later, my cousin told me she and my friend were in the surgical waiting room. They could not find out anything. They couldn't find out if I was alive or dead. And that surgery, by the way, had about a 10% possibility of mortality. They couldn't find out if I was alive or dead. They couldn't find out anything because the staff person in the surgical waiting room kept saying it has to be immediate family. When I found out that had happened, that's when I looked up HIPAA and discovered it doesn't. Now, I'm sure Sloan Kettering's lawyers know that, but they weren't there in the surgical waiting room. And institutions, I'm sure, train their staff very carefully about things like race, not being biased
That's
into
right.
racial
Right.
stuff. But they don't tell them you absolutely have to respect the right of the patient. In fact, where it starts, they shouldn't even have asked what the relationship is because it doesn't matter. It's none of their business. I said, these are the 3 people I want given my information. That's all you need to know.
It's absolutely frightening. It's
Yeah.
absolutely frightening because yeah, they have no right. You are able to write whoever you want to be able to give that information. And the
And
thing is, there was that nurse or whoever the administrator was, took it upon herself to tell you that that was wrong. And because you didn't know, the people who cared and loved about you were waiting and had no information. And
well, actually, I'm sorry.
no,
Not so
it's
much I didn't know. I was unconscious at the time. But now I will say the surgeon did, when he came downstairs, he did talk to them the same as you would with anyone. But you know what's important about this, I think, Sylvia? It's an example of how pervasive these social attitudes are. That staff
exactly.
person never questioned her own belief that it has to be immediate family because of the same social biases that resulted in the FMLA. For so long, it's been tribal kinship relationships, and you're not going to change that overnight.
And
No, it's not going to change
adopted-
overnight. But Jackie?
And the only adopted relationship, the only adoptive relationship that's valued as equal with blood is marriage, which is absurd since half of the people who have that adoption get divorced. But I'm just going to say that this is a little dramatic from the other side example of what Joan has been discussing. A lot of the most important people in my life have been teachers, and another teacher of mine was in the hospital in Pennsylvania. He was had a breathing tube down his throat because he had some blood clots removed, some different rather dangerous embolisms, which are blood clots that travel throughout the body that can threaten your life. And I knew that Blanford loved to hear Samuel Johnson's Lives of the English Poets, a beautiful collection of literary criticism that's so rich and delicious that it's like eating the most rich dessert you can imagine. It's the thing that most relaxed him was hearing Johnson. So I called and I talked to a nurse and I said, would someone just put the phone to his ear or just crack it up to his ear so I can read, because I know he's awake, he hates television. I think if I just read Johnson to him, he'll fall asleep. He's bored. He's lying there with the tube in his mouth. And she said, are you family? And I was so startled by this. And I said, what? And she said, are you family? And I said, yes. And because we are. And I said, are you immediate family? And I said, why are you adjudicating our relationship? Do you want me not to read Lives of the Poets to him? Do you have a copy of Johnson's Lives of the Poets? Do you have the Yale edition? Because that's the one without the mistakes. I got a little snooty, because I couldn't believe this. This is her patient. She's supposed to be making him more comfortable. And she's deciding on a sort of hierarchy. Where is this relationship in the hierarchy? And I was really mortified. And I talked to his sister, his blood sister, and I said, hey, Sandy, I don't want to call that hospital, as I do every day, and keep hearing, are you family? I keep saying yes, and they keep saying no. And so it's very hurtful to those of us who aren't patients too, who are trying to give love to be blocked. And now we have a special relationship teacher-student, and I knew the books he loved, and there were no ways the nurses were going to know this. And this was just a way to give him some psychological stimulation, a very and mentally active man while he was healing. I would think that would be part of the healing process. They would encourage it. If they could have just set up a little speakerphone, no one would have had to do anything. I wasn't asking them for heavy labor or moving him around. It was a simple thing. Can I read to him over the phone? And it was so monitored through the myth of marriage and it was like I was screened as a criminal trying to come in. So is this good for our society to be so couple centric that we are actually discouraging the more traditional values of community, friendship, mutual support? The studies indeed do show, sociological studies, that non-marital people, such as myself, give much more to social causes, are more available to neighbors, do more elder care, do more babysitting, and also do more in our friendships. And so I wonder, when I hear Belinda Luscombe write in Time magazine that the best ship you want to be on is marriage because that's the yacht, and the yacht of relationships, and everything else is a flimsy life raft. I don't think so. That has not been my experience at all. And I want everyone to have a good ship to sail the seas of life with. But what the title is written on the ship doesn't matter, as long as it's a loving commitment and people helping each other, supporting each other through health crises. It's valuable to the entire society. I also have to tell you, I do not love, as an unmarried person, subsidizing all these programs, family leave. Who's subsidizing those people, those married people that go on the family leave? The travel of people to the NIH, which is federally subsidized, hospitals that get aid, that enforce these, sometimes, as Joan was saying, illegal marriage-centric policies. I don't really love that coming out of my taxes. I'm not feeling too grateful for that at this moment.
Well, aside from that, because people who don't have children also don't like paying taxes for schools and whatnot.
No, I don't mind that at all.
No, but I think it comes down to the perception, again, that people should get married because that's what's going to make them happy, and that's what's going to give them a support system. And we have to get away from that, because that is so, it's not true. A lot of people who are married are happy, and a lot of people who are single are happy. It's not one or the other. But the stigma and the benefits that married people get it's got to change. It really has to change. And if nothing else, it has to change on the healthcare side, because we're talking about a system, as you said, Joan, not every spouse is capable, whether physically or emotionally, of taking care of a sick one. Not everyone has someone who can actually go out and do something. Our society really has to do more to embrace the fact that single people, there are thousands and millions of single people who are quite happy because this is what they've chosen. This is what they've chosen. I have a very good friend who, she lost her partner a few years ago. She has she'd like to meet someone, but not for somebody to come and live with her. You can share so many different things, like you've mentioned, there's relatives, there's friends, there's community. So I'm going to ask you both, what next step should be taken, or would you like to see? Joan?
Okay, a couple of things. There's a best-selling book that was just published in 2024. I'm sure Jackie has read it. I may say the first name wrong. Raina Cohen wrote a book called The Other Significant Others, and it's about the importance of friendship. The fact that that book is a bestseller, I think, is a very good sign. It suggests people are interested in this topic. It's beginning to be discussed in a way that it had not been discussed before. That maybe the most important people in your life are not necessarily only a romantic partner. And I love the fact that Jackie said that, as someone who has a boyfriend, to say, I don't necessarily bring him as my plus one, because we're talking about layers of assumptions, not just that everybody has a partner, but that everybody puts that partner in a particular place in their lives. So the success of a book like The Other Significant Others, I think, is significant. You were asking about what needs to be done next. One concrete thing I would like to see happen. I think I may be saying what Jackie was starting to say before. I see a difference between paying taxes for public schools when I don't have children and essentially subsidizing, let's say, a leave policy. Because since I don't have children, I don't have anybody I could send to the school, and I'm contributing to a public good, contributing to a community good. But what happens with family leave policies, it's as if I did have children and I have to pay the taxes, but I'm not allowed to send my kids to the school. I do have significant others. I have to subsidize other people's significant others, but I can't have access to that same policy to take time off to take care of my significant others. So it's more as if I have children, but you're telling me you have to pay the taxes, but you can't send your kids to the public school. So what I would like to see happen is, instead of the spousal benefits being automatically baked in, such as being able to put your spouse on an insurance policy, I would like to see employers make that part of a menu. So if you want to put your spouse on your insurance policy and thereby increase your total compensation package, then you don't get the gym membership, or you don't get the dental care, or you don't get the visual care. The idea that the married person gets everything that the single person gets and more is what I would challenge. Make it a menu. If you want to put your spouse on your insurance, fine, but then you don't get everything else.
Jackie?
Just following up on that. I have no problem subsidizing my colleagues' children's health insurance, and also we have an outstanding school system here in West Hartford. Our taxes are high in Connecticut, here in Connecticut and generally, but in this town particularly because the schools are so amazing. Part of the reason is because of what Joan said, but part of the reason is, if I myself had a biological child, and many women and men are doing this, adopting or having a child, I could go to the Human Resources Department and she wouldn't say you have to be married. All I would need to show is a birth certificate, and I could avail myself of insurance for the child. It's subsidizing every person in my department who's married, which is everyone except for myself, ever married, which is everything except for myself and one other gal that we just hired. When I'm not able to add Jim, Francis, any of my significant people, means that I'm earning a completely different salary. I'm not really, because they don't demand that the parents get married. So I feel like that is a really big difference. Okay, what I would like to see change is exactly what Joan said, but there's something else, which is that when I went out and started talking about non-marital rights, it was a much more unusual discussion, and I expected people to be very religious who were pro-marriage and to quote Bible and verse. They didn't. They quoted the chapter and verse of so-called definitive studies, as Michael Medved said to me on his show when he interviewed me, that say that married people are healthier, happier, more content, have better sex lives, are wealthier than all people, and that these studies are completely definitive. You will find such studies in medical journals. You will also find them in newspaper. You will also find them in drugstore magazines. They run the gamut. And I do agree that married people who stay married tend to end up better financially because we subsidize marriage in 1,000 ways. If we take away those subsidies, that will change. It's not because they're fiscal wizards. But what I'd like to see is for these bogus nonsense studies to stop. And I can tell you exactly how they work. And again, Time Magazine is the great practitioner of this. But what they basically do is they separate, it's all self-reporting. They separate married from unmarried people, and they ask who's happier. And then they interpret the data themselves. That is not the comparison that should be made. That's an erroneous comparison because those two populations are not comparable. The studies should ask married people and divorced people. They both took the marriage pill. Some, it violently didn't agree with them. Like if it was a drug, it was a bad drug. It had bad side effects. Others found it tolerable. Others found it helpful. If we could do something as simple as demand that when Time Magazine publishes a study, as it recently did, an issue saying more and more evidence piles up that shows that marriage offers everything life-enhancing and wonderful and is a prophylactic against just about everything terrible, and single life is a road to disaster and tragedy and opprobrium and desuetude. These are such prejudice-laden studies, but if we could just write to the editors, all readership, everyone hearing this, and say, what was the sample group you chose? How large was it? How long were they studies? Was this a self-reporting study? Did you appropriately randomize the populations so that you were looking at a comparable group, married versus divorced? Because unmarried people really don't have a place in this kind of study. Before you start championing the virtues of marriage, and also, are you familiar with Matthias Kalman's study, the best study done, 16 years, 11,000 people in Switzerland, and he found that people who were married actually reported quite significantly worse health over time. Judith Soons from the Interdisciplinary Institute, also highly trained, said the same thing. She's also from Europe, and it was 5,000, maybe 10,000 people, and she said this actually married people, their mental and physical health declines. She just found that it took a longer period of time. Daniel Kahneman of blessed memory, he just died, behavioral psychologist, Nobel Prize winning, said that wedlock is not a life enhancer and that it has really no impact at all on and now he was a brilliant economist. From what he could see, it was a completely irrational choice, since people get married thinking that they're going to stay married forever, and all around them they see divorce. But he and Amos Tversky basically thought people were irrational. That was their argument. But he just said, as far as marriage goes, he had reviewed all the data, and he could see that it made no significant difference at all in health or happiness. And I feel that if a lot of the attitudes that we're talking about are no longer bolstered by religion, by the rabbis, the preachers, the priests coming out and preaching chapter and verse, we're in a culture that holds science up, and social science, as the great truth and the great distinguisher between truth and fiction. But often it is fiction, as Joan has experienced in hard science environments, as I've experienced painstakingly going through studies in Europe and America and seeing the glaring differences between them. European countries are much less pro-marriage. They have it, but it tends not to be the distinguishing line between have and have-nots. so they don't have to sell it as hard. But if you ever pick up Cosmo or any kind of magazine that sells marriage as it's almost a sales piece, but it pretends to be a representative piece of rigorous scientific research, write to the editors immediately and say, I want to see the data. I want to see the raw data, unfiltered. And I want to know who were the control groups, how long were they studied, under what circumstances, did you factor in other conditions, such as the fact that people in Ithaca, New York get depressed in February, whereas people in Naples, Florida don't. It doesn't have to, I mean, the weather even affects people a lot. So I'd like to see a challenge to the whole pop psychology, pro-marriage,
way of life right now.
The approach to life right now,
Okay.
because I think a lot of people don't understand what the cheater techniques are. And Bella DiPaolo, Joan and my colleague, blew the lid off this. And really, all of her books deal with it. And I think people need to read them, and they need to take it with a huge grain of salt anything that promises that marriage is going to be a happy pill.
We're going to have to continue this conversation at another time.
I think so.
This has been
This
great.
is too good.
This is great. I just want to leave. Joan, do you have you have a website?
I do.
Where can people find more about you and connect
They
with you?
right, JoanDelFattore.com.
Okay.
And I'll go to the website. It has links to all of the articles. If I can say one more thing based on what Jackie said, the other thing is studies clearly show that marriage benefits men more than women in terms of health outcomes.
Oh, yes.
So another thing that needs to be distinguished is to what extent, in some of the medical articles, if you factor out the men, the health outcomes between single and married women are the same. So that's another level I would suggest that needs to be a level of scrutiny that needs to be applied. So I'm at JoanDelFattore.com. I'm on Facebook as Joan DelFattore, and I have gotten off X.
Okay. And Jackie, where can people find you?
Well, I'm entering the 21st century by creating my own website, her website, and we are waiting for the domain name to come through, but it should be JaclynGellerPhD.com. And I encourage people to visit it. I think it should be up and running by Monday, and to contact me with whatever questions they have, and to continue this discussion. Sylvia, you've been you may not be anti-marriage in the way that I am, but you've been an extremely gracious host and a fantastic, you've created a great environment for open discussion of these issues. And like I said last time, you're one of my role models too. And thank you.
Ladies, thank you very much. This has been wonderful. You can find us on all of your popular podcast platforms. And of course, our website, sylviaandme.com. Stay safe, stay healthy, and as always, stay tuned.